I decided to take on the biggest cyst on an ear that you'd ever seen. This patient came to our clinic and he was desperate to have this cyst removed before his wedding. So what do we do at LipoMassist? Well, we did what we do best, and that's we got the cyst out. So remember, if you're new to the channel, make sure you subscribe so you get the latest notifications. Put your comments down the box. Have you seen a cyst bigger than this? And more importantly, enjoy the video. I'm Dr. Carla today, and this has been brought to you by LipoMassist.com, the home of cysts and lipoma removal. Thanks for watching. I'm Dr. Khaled. Now, this video, I decided to take on this large epidermoid cyst just sitting behind the right ear. It's probably one of the largest epidermoid cysts I've operated on. This gentleman really needed it removed. It was really knocking him back in terms of self-confidence. I think his marriage was coming up as well. He's got a wedding coming up. And so getting this epidermoid cyst out safely was his priority. So I took on the case, and if you watch, you'll see exactly how we went about doing it and how we changed basically life-changing surgery within a few minutes. Now, epidermoid cysts, a lot of you ask, what are they? Well, they're basically oil glands that sit inside the skin, and for one reason or another, they continue to produce the oil, but there's no opening. Either they're manufactured incorrectly or the pore has become blocked. So the oil continues to be produced, but it gets stuck under the skin. And as it does that, it kind of distends the skin and stretches it. And here we have at about a 3-4 centimeter epidermoid cyst. When we examine it, it's really loose under the skin. It's not tethered to any deep tissue. Now, the interesting thing about epidermoid cysts is that they're kind of free floating in this no man's land of tissue. They're not kind of stuck down in the skin. You know, they're not stuck down in the muscle. They're sitting in between the dermis and the fascia that wrap around the muscle. This kind of free volume space that everything is kind of connected with a very flimsy connective tissue and basement membrane, and so you can easily prise them out. So first incision's made, and obviously the first thing we do is we drain it, get that sebum out, and that way we can make sure that the incision is small. Now, a lot of patients ask me, Doc, how big is my scar going to be? Well, look, if you've got a large cyst or a large lipoma, we're going to have to do a bigger incision than if it was smaller. And that's just physics. You can't get something massive out of a tiny hole, unfortunately. However, because of the technique we use, we're able to have an incision significantly smaller than what the actual size of the lesion is. And as a rule of thumb, I always say that if you've got a diameter or the length of the lesion, we would say that the incision is probably about 2/3 of that. So you're saving about a 30-40% in terms of scar formation. And now that the cyst is removed, has been drained, you can see that that incision has really collapsed on itself and it's looking pretty small already. Now what's left is we have to get the sac out. Remember, if you don't get the sac out, there's a high risk it can grow back. Now, as I mentioned earlier, these epidermoid cysts are sitting within this kind of free no man's land of connective tissue, this layer that is neither occupied by fat or muscle or skin. And it's just this kind of basement membrane, and it's kind of attached with these flimsy adhesion and cohesion elements. So all you have to do is separate those adhesions and applying some fixed, firm, not too sharp, not too strong traction on the artery forceps, as we're doing here. We've clipped it, just applying a gentle force, consistent. Don't go mental and yank this thing out because you'll rip the membrane itself, and which you don't want to do. You want to maintain the membrane. So what you should do is make sure that the area is nice and clear, that any firm adhesions have been separated. Now, you might want to use the scalpel, or as you have seen in this video, we use a curved scissor, which is coming in right now. And what we're doing is some blunt dissection. So we're just separating those adhesion molecules, separating them from that no man's land around the epidermoid cyst until we can pull out that epidermoid cyst sac in one piece. So a bit of light traction, just keeping the visual field nice and clean, away from any blood, so it's nice and clear. Remember, if you've got something like this, then reach out to me, Dr. Carla today. You can contact me at lipomassist.com, so contact at lipomassist.com, or just message. If you've had some of this removed before, put it in the comments. What was your experience like? How long did it take? Was it painful? So here we are. We're applying some firm traction, just cleaning that off a little bit. And what we don't want to do is go too fast, too quick. We want to make sure that our area and the cyst is prepared for that final traction. So again, using the blade there just to blunt dissect, no sharp dissection, just blunt dissection, pushing away those adhesion filaments off the wall, off the epidermoid wall. And as you can see, light traction, a bit of a push, and voila, look at that. The epidermoid cyst has presented itself. Wow, not only did it produce loads of sebum earlier on in the video, it still had a lot of sebum inside. So this is like a very, very large cyst. And as you can see, the skin has completely collapsed on itself, and it's going to come out really nice. And you can see that those are the very fine, you see those white streaks, those white flimsy connective tissues. Those are the elements that are kind of anchoring this cyst down. So we're just going to separate them with our blade there, just separate them away. And again, just applying a mild traction on that epidermoid cyst, and like that, it's gone. Look at that. It wasn't even 5 minutes. A cyst that's been there for over 5 years, that's knocked someone's confidence, completely disfigured them, has been removed within 5 minutes in its entirety. This thing is not going to come back. We saw that the sac was removed in its completeness. Now, what we're left behind, obviously the skin has been stretched over those years, but the great thing is, for all those who've lost a bit of weight, your skin does remodel, it'll reshape. Some of that laxity that's present will just come back together, and it'll heal really nicely. And that's it, really. We put in a couple of very, very fine stitches, not more than 2, I'd say. Already the incision's about less than a centimeter, less than 10 millimeters. Very little bleeding, totally superficial. Obviously, when you're operating an area like this, there are some major organs you should be wary of. And so, don't go too gung-ho with your incision, but you've got to be wary about the anatomy. And really, really good results. So let me know what you think of the video. Did you like it? Was it as you expected? Have you seen anything like this? Have you got any friends who've got cysts or lipomas who need treatment? Maybe you should recommend them to us. So if you haven't already, do subscribe, put your comments down below, hit like, share it with your friends. You can also catch us on Instagram and Facebook and TikTok and all the popular social media sites. So until next time, I'm going to wish you all goodbye and take care. All the best. It's goodbye from me, Dr. Khaled Sadek, and lipomacyst.com, the home of cysts and lipoma removal. Take care, everybody. Bye-bye.